Welcome back, friends and fellow surgeons. Myself, Dr. Yatish K. I'm going to be demonstrating a video on endovenous laser ablation for the varicose vein surgery in this patient. So, patient is placed in supine and slight reversed underbug position. Ultrasound probe is received in sterile aseptic conditions. Uh, the important skill in this surgery is to getting familiar with the ultrasound device. So the ultrasound probe is delivered in under sterile aseptic precautions, and the first step is to locate our great saphenous vein. So over here I'm cannulating the GSV from the ankle. uh, how do you identify GSV? GSV is the most superficial vein, and as you know, any vessel in ultrasound which is compressible is always a vein. So over there, my assistant is pointing out at the GSV. I'm gonna show you the zoomed in picture of the GSV there. So once we see the GSV, the next step is to cannulate it using an ultrasound guidance by the Seldinger technique. So to do that, you have to be or you should have at least a basic experience on using an ultrasound machine. So first, the principles of or I'll just walk you through the basic steps of how to use an ultrasound or how to do a cannulation of the GSV using an ultrasound machine. So first, sit yourself comfortably, looking at your ultrasound machine. Then fix the ultrasound probe by fixing your target location, which is a GSV, and the GSV should be at the center of the screen. And the next step is to gain an access. So how do we gain an access? Using a IV cannula, preferably pink size. You have to first make sure where is your entry point. So how do you do it? You have to poke on either side of the probe, make sure the entry is in the center. Then comes your access point. So how do you access it? Initial entry is close to the probe. Second thing, it's around an angle of say 45 to 70 degrees. As the GSV is very superficial, you tend to puncture it through and through. So you just have to puncture it uh, superficially, making sure your needle is inside the vein, and try to withdraw it once there's a free flow of blood that ensures that you're inside the vein. Once you're into the vein, next you're going to put in your guide wire. Once your guide wire is in, you should always check if your guide wire is inside the vein or not. And once you're say you've confirmed that your guide wire is inside the vein, then we're going to introduce something called a vascular sheath. So to insert the vascular sheath, basically you have to make your access entry a little bit wider. So I'm just gonna use a 11 mm blade and make a really small stab injury so that your vascular sheath enters into the vein, and then you're gonna remove the dilator and you're gonna push your sheath inside the vein. So once you know your sheath is in position and you have removed the dilator, our next step is to position our laser fiber. So these are the basic steps in how to cannulate a vein using an ultrasound guided. And obviously, initial few cases we tend to perforate the vein, and sometimes like we go through and through the vein. That's all acceptable, but you'll gain or you learn throughout your experience. So once we have positioned our vascular sheath, then is our laser fiber introduction. So I've just put in my laser fiber. I'm slowly negotiating it through the perforators in your calf and perforators in your thigh. Then I'm going to reach till the saphenofemoral junction. So once you have reached the saphenofemoral junction, it is mandatory for you to confirm the saphenofemoral junction. And how do you confirm it? You will confirm it by looking at your Mickey Mouse sign. So what is Mickey Mouse sign? It is your common femoral vein, great saphenous vein, and your common femoral artery. So once you have confirmed that landmark, you're going to start firing your laser from almost 1.5 to 2 centimeter distal to the SFJ. The reason is just to avoid thermal injury to your common femoral vein. And once you've placed your laser fiber, the next thing is to give your tumescent anesthesia. And giving tumescent anesthesia is the most critical step in case of endovenous laser ablation. So how do you prepare tumescent anesthesia is you're going to take around 250 to 300 ml of normal saline, and you're going to take 1 ampule of adrenaline and 1 ampule of 30 ml of lignocaine and 20 ml of your sodium bicarb. You're going to mix it in a kidney tray and then you're going to instill. And why do we give tumescent is one, it improves the efficacy of the laser and it reduces postoperative pain. It basically separates the vein from the skin so that the thermal spread from the laser fiber is reduced to the surrounding tissues. So now that I've given the tumescent, the next step is to start firing the laser. And I'm going to use 80 joules per centimeter over here above knee, and it's 8 seconds continuous wavefront. So as I start firing the laser, as you can see, my assistant is um, holding the ice pack. Number one, number two. As I come down, my assistant keeps giving the tumescent anesthesia throughout the course of the vein. So the mechanism of how a laser works is it causes an endothelial destruction, which leads to collagen, contraction, and it leads in vein closure. So, endovenous laser ablation has become the most effective, minimally invasive treatments for the varicose veins, and it is easy to perform when you can understand all the steps and you do it accordingly and have a really safe practice. Keep your seniors around if you're doing starting your initial few cases, because there have been few cases where excessive thermal injury has led to deep vein thrombosis in the postoperative period, which is really a drastic complication where you shouldn't never end up or land in such situations. So yeah, as you could see, we are continuously firing from the, I mean, almost 2 centimeters from the SFJ distally, and once we come below the knee, we're gonna reduce the joules to probably 60 joules per centimeter and 6 seconds continuous wavefront. The reason is one vein is very more superficial below your knee, and so you don't want to have a thermal injury or a dermal spread. So for that reason, we're gonna reduce the joules, and the same thing we're gonna start firing, and the steps remain the same. Give tumescent anesthesia, make the ice pack ready, and start firing your laser fiber. So once like you're almost near to your stab, the next step is for you to remove the sheath out of your punctured wound, because the sheath is almost 6 centimeters in size. So if you keep on firing your laser fiber, the sheath keeps burning. So once you reach almost to the almost near your entry side of your of entry side of the GSV, the most important thing is to make sure that you remove your sheath and then start firing the or start ablating your residual vein, whichever is still left. So you see, I'm just removing the sheath there, and I'm just finishing up the residual GSV ablation over there. And once you're done with your ablation of final few centimeters, I'm just gonna fire it and follow the same steps again, and I'm gonna withdraw my laser fiber. So this completes a procedure of endovenous laser ablation, and I've recorded this video because there is no videos where they've clearly explained about the endovenous laser ablation, and it's purely helpful for the surgeons who are starting to do laser varicose vein surgeries. So I feel this video might be helpful for most of the people who are yet to learn how to cannulate the vein or what are the principles of how to ablate the vein and things like that. So this is purely for educational purpose. If you really do find this content more helpful, kindly please do like, share, and subscribe. And kindly do write your doubts in the comments. I would like to clarify if it's within the reach. So This completes the video or the illustration or demonstration on the EVLA. Thanks a lot for watching, guys. Stay tuned for more educational content.